Good evening. I need to speak to you again about the coronavirus. The last few weeks have transformed our lives in so many different ways, in ways that we could not have imagined. I know it's been difficult, sometimes dispiriting. The frustration of having our lives restricted, the uncertainty about when things will get back to normal, and the fear of the virus itself. As a nation, our physical health has been attacked, our mental health eroded, our economy battered, and our society put to the ultimate test. Many people are lonely and enduring the pain of isolation. Many people are grieving in silence. Many have lost their jobs. Many fear losing their businesses, and many have lost their lives. I know for me the worst part has been the daily text message I receive around 5 o'clock every evening with the latest number of notified deaths and newly diagnosed cases. I yearn for the day when it stops. Tonight I want to explain to you why we have to extend current restrictions until the 18th of May, and also share with you our plan to reopen our economy and society in phases starting on that day. Thanks to you, we are making a real difference in the fight against Covid-19. The curve has been flattened and has now plateaued. Thousands of lives have been saved. Our hospitals and healthcare staff have not been overwhelmed. But we've not yet won this fight. Every day we've too many new cases. We still have too many people in hospital and in our intensive care units with COVID. And every day, regrettably, including today, we have too many deaths. Our scientists and doctors tell us that if we relax the restrictions too soon, we could see within a matter of days our ICUs overcrowded, our care homes under renewed pressure, and our healthcare staff overwhelmed. Everything we've achieved would be lost. Our best chance of winning this battle will be swept away, and we could be back to square one. So we must go on for a short time more. As I mentioned earlier, we have a plan to ease restrictions from the 18th of May. But before that, we need 2 more weeks of tight restrictions to weaken the virus further, so it doesn't have the strength to make a comeback when we start to interact with each other again. During this period, we are making some changes. We're extending the distance you can leave your home. So from next Tuesday, it will be possible to travel up to 5 kilometres from your home for the purposes of exercise. For people who are cocooning, the public health advice is to continue to do so. However, from Tuesday, it will be possible to go for a walk or a drive within 5 kilometres of your home if you avoid all contact with other people. Our plan is to reopen the country in a slow, staged, phased way. 5 stages, 3 weeks apart, starting on May 18th, and all things going to plan, with the 5th phase commencing on August 10th. Unfortunately, the risk of a second wave of the virus is ever present, so we can only move from one phase to the next if the virus stays under control between each phase. And there is a risk that we'd have to go back a phase if that happens. In any scenario, at least until we have a vaccine or an effective treatment, there will be a long-term need for physical distancing, good hand hygiene, respiratory hygiene, regular cleaning, and for people to stay at home and isolate if they're sick. It will take some time for our lives to get back to normal, to a new normal, but it will happen. So on the 18th of May, Ireland begins to reopen and begins that journey to a new normal. From that day, outdoor work, like construction and landscaping, will resume. Some retail outlets like garden centres, hardware stores, repair shops will reopen. And some outdoor sporting and fitness activities in small groups will be allowed. Many regular health services will resume operating, and it'll be possible to meet small groups of friends and family outdoors. Not long from now, some summer night, we will see our friends again. In later phases, other workplaces, businesses, childcare, preschools, restaurants, cafes, bars, cinemas and gyms will reopen. Schools and colleges will reopen in September, October, at the start of the new academic year. Getting people back to work and restarting businesses will not be easy. I know that. It won't be possible for people just to pick up where they left off. Businesses are going to need help to get going again. So tomorrow morning, Cabinet will meet again to agree further actions to help our businesses to restart, reconnect and rehire staff who've been laid off or furloughed. Separately, a national protocol is being developed by government, employers and trade unions with the assistance of the Health and Safety Authority and the HSE. This will enable a gradual restart of economic activity as restrictions are eased, while protecting the health and safety of all workers as they return to work. We will do everything possible to get enterprises back up and running so you can get your job back. While it will take some time before we get to enjoy again the things we're missing, from the comfort of our families to a night out with friends, those days will come again. Over the last few weeks, I've received about 10,000 pieces of correspondence, and every day I try to set aside a little bit of time just to read some of them. People sharing with me their hopes as well as their fears. A letter from Jessica, who's a wheelchair user, who feels an enormous cloud of loneliness around her. A letter from Anne-Marie, a healthcare worker, who contracted coronavirus at work, who answered her own question about why she put herself at risk. She said her patients were like family. She said they call us their best friends. A letter from Phil, a pensioner who lives alone, who admits to struggling with isolation and the lack of human contact, whose mental health is starting to suffer. Phil says in his letter that we've a long road ahead of us, but one worth taking if it means we all stay safe. Rachel, aged 13, who's worried about her grandparents and wondering when she'll be able to go back to school. Someone worried about the future, but who ends her letter asking me to stay safe. We're doing this for Jessica, for Anne-Marie, for Phil, for Rachel, and for everyone else who's struggling as best they can to come through this crisis. We're doing this for each other. The coronavirus is cruel and inhuman. However, the stories I'm hearing every day are stories of human kindness. The kindness of healthcare, nursing home, hospice and hospital staff who've comforted and cared for the sick and dying with dignity at the most distressing time. The tragedy of every death, whether linked to COVID or not, is made far worse by the fact that we've been unable to come together to mourn our loved ones or embrace and comfort each other as families. But while we're unable to gather, we are still grieving. And when we come through this, we will come together as a nation and grieve together for everyone who's died over the course of this emergency. In every city, in every town, in every village, people have met the demands of this crisis with remarkable courage and a sense of solidarity. We all know someone who is suffering because of these restrictions, just as we all know someone who's on the front line or performing an essential service. The best way of helping them is staying the course and continuing this fight. So tonight I'm thinking of parents juggling work and homeschooling, all the young people deprived of the companionship of their friends and the opportunity to take part in sport, the couples who've had to cancel their weddings, the grandparents who crave the opportunity to hold their newly born grandchild. We all have our own stories, and each one combines to form a tapestry of struggle and sacrifice and sorrow. It has been worthwhile. It is working, So let's finish what we started. Thousands of lives have been saved. Hundreds of thousands of people are healthy and untouched by coronavirus because of the sacrifices and choices that you've made. 70% of people diagnosed with Covid-19 have now made a full recovery because of the care and attention given to them by our health service. I know that figure would have been so much lower if our health service had been overwhelmed. So while there is still so much that we do not know, tonight there is hope. In the weeks ahead, that hope will drive us forward as we plan to emerge safely from this crisis. Thank you very much. Stay safe, and good evening. And good evening.
Well, and Taoiseach Leo Varadkar there just updating the situation on the Covid-19 restrictions, speaking from government buildings. We will be on air here until 7:30 with reaction and analysis to what the Taoiseach has just outlined, so do stay with us. You'll have heard him say there the current restrictions are extended until the 18th of May. After that, the country will begin to reopen in 5 stages. 2 exceptions from next Tuesday. That 2-kilometre limit will be extended to 5 kilometres, and the over 70s who are cocooning will be allowed to go out for a walk or a drive within 5 kilometres as long as they don't have any contact with anyone else. Well, let's get some initial reaction here from our science correspondent George Lee, who's with us here in studio, and our political correspondent Micheál Lahan, who is at government buildings. George, the Taoiseach talked there about keeping with public health advice, so no dramatic easing of the restrictions from now.
Well, and that's the key thing. Obviously, there are a lot of things that are going to have to be put in place to make sure that we can get to the stages that he has just outlined, because it's about much more than some relief for people cocooning or anything like that, or even the 3 to 5 kilometre things. It's about public safety. We're still in this war against this virus, and what he's outlined there is that we certainly appear to have been winning a battle. But when you win a battle, you haven't won the war. And as soon as we let up, this virus is likely to be problematic in the community, and we need to be able to clamp it down. And what he maintained there was every single stage depends on that. You know, he would like to have all of these 5 stages of 3 weeks apart, and that each of them will be progressive, but he warned that every one of them depends on how the virus behaves, and that really depends on how we behave. This isn't a get out of jail kind of card he's given us at all. It is a plan, a roadmap where we can see ahead that there is a way forward, and some relief obviously immediately for some of those people who need to get out, and also for people who want to go a little bit further than 2 kilometres. But and I think when he underscores how important it is for people to remain, and you could tell from his tone, to remain very careful about the risks which are out there, because we're all dependent on those risks. For those who are elderly and who will now be delighted at the opportunity to go out and to go a bit further, the reality is they will know themselves the risks. They will know that when you look at the numbers, and we get numbers for over 65s, and we have 1,265 deaths, but about 100 of them only are for people who are under the age of 65. The vast majority of the deaths are for older people, and it is a relief for them to know that that there is light at the end of the tunnel, that the battle that people have been fighting has given some relief, but we're not out of it yet. And I think, to me, that was the most important thing. A staged plan, a slow plan, a plan with lots of possibilities for people to look forward. Light is somewhere at the end of the tunnel, but it is a long tunnel, it is a bumpy tunnel, and we hope to get there by the end of August and into September, as he says, but it depends on how things develop. But it is good news that we have a plan. I'm more impressed with the plan than the 3 to 5 kilometres. I'm more impressed with the plan than the fact that people can go out for a little bit further, or and so on, even though they are great relief. But the thing about having the plan is that we have been making significant progress. We have won a battle against this virus. We've managed to keep the rise in the virus and the growth in the daily cases on a 5 daily moving average close to 0. When you look at when the deaths are allocated to the correct dates, that the death toll is coming down. It's the work of everybody in this country, but not to blow it. I think that was his message.
OK. And of course, Micheál, there's balancing those public health issues that, George, you've outlined with getting the country back up and running, getting the economy going and so on. And the first stage on the 18th of May, some workers will be allowed to go back to work.
some outside workers, construction workers, gardeners, people working in the open air will be allowed back to work. At that point too, you'd also see hardware shops reopening and some non-contact sport returning as well. So that's kind of a key point in the cycle. I suppose what is really significant to watch from here on in is that the political balance that you speak about there, that will have to be struck, and weighing up things like the economy and the medical advice that's coming as well. And already you could see that politicians are beginning to grapple with this, because as the transmission figure goes down, as the number of cases, it's hoped will continue to go down, then big political calls have to be made. And of course, when big political calls are being made, questions will have to be asked to, and there are some questions around decision making being asked already. I think it was noteworthy there that the Taoiseach didn't take questions here in government buildings. He will be answering questions on the Late Late Show tonight, but there will be many questions from journalists and from the opposition on the future steps ahead and just exactly how those decisions will be reached in those 3-week cycles that he spoke about. But it was a message of hope and getting people to stick with the plan for another 2 weeks. I think that's interesting, because we know that some within his own cabinet over the last fortnight, and particularly in the last 48 hours, have been pushing for greater easing around restrictions, for a little bit more give. But there's 2 more weeks, a fortnight more of tight restrictions in place. We know that now.
All right, thanks for that, Micheál. And we will have some opposition members asking just those questions a little later on the programme, as we are on air here on 6-1 until 7:30. Now, still to come this evening, we will have much more on the Taoiseach's statement on that roadmap to reopening Ireland and lifting the restrictions related to Covid-19. We'll have political and medical reaction.
And garden party, how one County Louth woman marked her 90th birthday dancing